of our office buildings. Third, the restaurant and hospitality sector provided an updated plan which has already been incorporated by the Department of Public Health and includes specific social distancing guidelines and recommendations to help restaurants protect employees and to protect the customers. The fourth and final presentation was by the film, entertainment, digital media, and theme park sector, sharing its work on an industry-wide with an industry white paper that they created in conjunction with labor partners to resume filming and entertainment. This past Friday, the county received guidance from the state to reopen additional key sectors as early as June 12th. This includes schools, day camps, museums, camping, and spectator-free events. The county is actively reviewing the guidelines from the state to determine how these organizations can reopen with necessary safeguards and with the precautions in place. An announcement will be made prior to Friday regarding which sectors can reopen with their final protocols. This is another important milestone for the county as we continue our path toward recovery and transition from safer at home to safer at work and safer in our communities. As more businesses and activities reopen, I encourage all our residents to continue to practice social distancing, wear cloth face coverings, and follow all the public health guidelines. There is still a pressing need for workers to access essential personal protective equipment. 2 months ago, BizFed launched a partnership with local and state leaders, labor leaders, and business organizations. They have been working together to mobilize and donate much-needed equipment and supplies to protect workers throughout Los Angeles County and to mitigate the spread of COVID-19. Last week, a group of generous volunteers distributed much-needed protective equipment and 900 bottles of hand sanitizer and 900 bottles of hand soap to child care providers in Burbank and in Lancaster. For more information on how you can support this important cause, please visit BizFed Institute online at bizfedinstitute.org. Or you can reach out to my website at katherinebarger.lacounty.gov or through social media. In closing, I want to take another moment to recognize the events we have witnessed over the last 2 weeks. Across Los Angeles County, thousands of residents are displaying their dedication to justice and equality. Thank you to all those who continue to come together peacefully in the spirit of unity and collaboration to find solutions to combat justice. And I also want to thank those on the line, our first responders, who are helping us keep peace on the streets. We appreciate you each and every day, and we know you are working hard under very difficult circumstances. In a time when we can be so divided, especially after months of being apart, this shows that our communities are still deeply connected. We appreciate each and every one of you. Now, with that, I would like to invite Dr. Barbara Ferrer up to give the weekly stats. Thank you.
Good afternoon, everyone, and thank you so much, Supervisor Barger, and to the entire Board of Supervisors. Throughout this pandemic and our recovery journey, you've shown incredible strength and leadership, and I'm very grateful for all you do for LA County. To update you on our current status, I'm sad to report 10 additional people have died from COVID-19. 6 of the people who died are over the age of 65, and 3 people over the age of 65 who passed away had underlying health conditions. 3 people who died are between the ages of 41 and 65, and 2 of the people in this age group also had underlying health conditions. Information on the 1 death reported by the City of Pasadena is available on cityofpasadena.net. Of the 9 newly reported deaths today, excluding the death reported by the City of Pasadena, 1 death was associated with a resident at a skilled nursing facility. This brings our total number of deaths to 2,655. And every day I do report on the numbers, knowing that they represent real people who have had amazing impact in their own lives and have now passed away. And they do represent also families and friends who are experiencing profound loss. So our thoughts and prayers are very much with everyone, and we're very sorry for your loss. For the 2,463 people who passed away where race ethnicity has been identified, 41% are Latino Latinx, 28% are white, 18% are Asian, 12% are African American, less than 1% are Native Hawaiian or Pacific Islander, and 1% identified with another race or ethnicity. 93% of the people who have passed away from COVID-19 have had underlying health conditions, and this number has stayed consistent throughout the pandemic. So if you're a person with an underlying health condition, this is a reminder that we do ask that you stay home as much as possible, even during our recovery journey. Today we're reporting 823 new cases. And I want to just note that typically on Mondays our death and our case counts are lower because of a lag in reporting from the weekend. This does bring the total number of people who have tested positive for COVID-19 in LA County to 64,644. The 64,644 total cases we're reporting include 2,227 total cases reported by the City of Long Beach and 987 total cases reported by the City of Pasadena. Both cities have independent health departments. We're also reporting 462 confirmed cases among people experiencing homelessness. Less than half of these, 205, were among people who were sheltered and who are now appropriately isolated and their close contacts are quarantined. I'm also sad to report that one additional person experiencing homelessness has passed away from COVID-19, and this does bring the total deaths among people experiencing homelessness to 14. And to the family and friends of the person who died, we offer you our deepest condolences. 6,923 people who have tested positive for COVID-19 have been hospitalized at some point during their illness, and this has now dropped to 11% of all of our positive cases. And there are currently 1,399 people who have confirmed cases of COVID-19 and are hospitalized. 30% of the people who are hospitalized today are in the ICU, and 21% of the people are on ventilators. We've also investigated a total of 584 residential congregate settings and non-residential settings with at least one confirmed or suspect case of COVID-19. Of these, we currently have 488 ongoing investigations, and we've closed 96 investigations. These settings do include nursing homes, assisted living facilities, shelters, treatment centers, supportive living, correctional facilities, workplaces, food and retail, and educational settings. The total confirmed cases in institutional settings is 15,436, and this does include 10,158 residents and 5,278 staff members. And I am sad to report that 1,432 people who have been living in institutional settings died from COVID-19, and that 89% of the people who passed away and were living in institutional settings did reside in our skilled nursing facilities. Our hearts go out to the families and the friends of the people who have passed away and were living in these facilities. We're continuing to work hard with our partners and the facilities to make these spaces as safe as possible, both for employees and for residents. And I do want to note that the death rate of people living in the skilled nursing facilities, while still high and happening each day, has dramatically come down over the last 2 weeks. We are reporting 989 confirmed cases at some point in jail facilities. 745 are among people who are incarcerated, and 244 staff. There are 178 cases in the state prison, 128 among people who are incarcerated, and 50 among staff, and there are 758 cases in the federal prison facilities, 743 among people who are incarcerated, and 15 among staff. There are now 28 cases in the juvenile facilities. This includes 13 among youth and a slight increase up to 15 among staff. You can find information on confirmed and suspect cases in these facilities, as well as our dashboard for recovery on our website at publichealth.lacounty.gov. The LA County Sheriff's Department is reporting 317 positive cases among staff, 349 staff are quarantined, and 2,086 staff have returned to work. The LA County Fire Department is reporting that 601 staff members were tested for COVID-19. Only 31 staff have tested positive, 12 are isolated at home, 30 have returned to work, and 1 person is homesick. Thank you again, Sheriff Villanueva and Chief Osby, for providing us with this information. There are now over 708,000 COVID-19 test results for individuals that have been reported to the LA County Department of Public Health, and 8% of the people who were tested over time have tested positive. I want to remind folks that there are still appointments available at the regional testing sites. You can go to covid19.lacounty.gov/testing to find a site near you and to make an appointment. I do today want to give an update on cases among healthcare workers. The numbers I'm reporting include healthcare workers who work in LA County, even though they may live in other jurisdictions. And there's a total of 6,031 healthcare workers and first responders with confirmed cases of COVID-19 in LA County. This is an additional 633 new cases since the previous week and accounts for 11% of all of our cases. Cases have been identified among 27 different occupational settings, and the vast majority of the cases continue to be among healthcare workers from skilled nursing facilities and hospitals. Skilled nursing facilities account for, similar to last week, 43% of the cases, and this is partly a reflection of the increased testing at all of these sites. Hospitals account for the second largest group, which is an additional 25% of cases. The additional facilities that are reporting positive cases among healthcare workers include outpatient facilities, home health, first responders, and mental health settings. Nurses continue to account for the majority of positive cases at 44%, but cases have been identified among a range of occupational roles, including caregivers, medical assistants, physicians, and the people who are working in environmental services and food services. The source of exposure is known for 60% of the healthcare workers who tested positive for COVID-19. And of these 60%, 79% of the healthcare workers with a known exposure were exposed at a healthcare facility. 6% of healthcare workers have been hospitalized for COVID-19 at some point in time. I'm sad to report that 41 healthcare workers have passed away from COVID-19. And this is 2 additional people since our last report earlier last week. 29 of the healthcare workers who passed away worked in skilled nursing or assisted living facilities. 6 people worked in hospitals, 2 people worked in home health, 1 person worked in a correctional facility, 1 person worked in a laboratory, and 1 person who died worked in an outpatient facility. There's 1 healthcare worker for whom the workplace setting has not yet been identified. And I want to note that we're still gathering information on the race and ethnicity data for the healthcare workers who have passed away. I hope we'll have that for you shortly. The loss of the healthcare workers is devastating, and to those who are mourning these heroes, we join you in honoring your loved ones. And I also want to give thanks to all of the healthcare workers across the county from the bottom of my heart. Every day you give so much to your work and to our communities, and we owe you a huge debt of gratitude. In closing, I want to acknowledge that we're at a place in history where we're facing critically important issues and we're engaging in crucial work. And many are committed in this moment in the continuing fight to end racism. And I applaud all of those who have stood for justice over the last 2 weeks. So many are returning to jobs in what feels like a very different economy and a very different workplace. And many are hoping that jobs will return as businesses reopen, and in the meantime, continue to struggle to make ends meet. So the reopening is challenging, and we're still in the midst of a pandemic. COVID-19 remains easy to transmit, and it does continue, as you hear from our data during the week, it does continue to cause serious illness and death. Every single social interaction that happens outside your household comes with risk to both the people who interact and, if anyone should get infected, to the people they live, work, and play with into the future. And we can all think about the potential impact on people who are more vulnerable because of their age or their medical condition. So please, as a reminder, wear the cloth face coverings when you're out and around other people. Practice your physical distancing by staying at least 6 feet apart from others whenever possible. And I really ask, if you're running a business or you're in charge of making a public space safer for those who are using it, please follow all of the directives for reopening, because this is one way to make your space as safe as possible for employees, customers, and residents. If you've tested positive for COVID-19 or you're having symptoms, please isolate for 10 days and 72 hours after the fever and the symptoms subside. And if you're a close contact to someone who is positive for COVID-19, you too need to self-quarantine for a 14-day incubation period. And if you spent time in large gatherings, whether this was at the beach, in a shopping mall, or protesting peacefully, and you think it's possible that you've been exposed to COVID-19 because you were not able to keep physical distance and not everyone near you was wearing a cloth face covering, the best step to take is to self-quarantine for 14 days and to be particularly careful to protect the people around you who may be at great risk for illness if they become infected. If you've been exposed to someone at these gatherings that's positive or likely to have been be positive for COVID-19, it is appropriate to get tested. But it's important to remember that a negative test result does not mean that you can't become infected during the 14-day incubation period. This is why, even if you tested negative, it's still important to self-quarantine for 14 days. And if you do start to develop symptoms, you need to contact your health provider, and now you will need to isolate for an additional 10 days. Many of you, I know, have made these actions part of your day-to-day life, and we thank you for all you are doing to save lives. And thank you also for doing your best to help children, parents, partners, friends, and neighbors get through these continuing times of great challenge. And now we'd like to open for questions.
Thank you. And ladies and gentlemen, if you wish to ask a question, please press 1, then 0 on your telephone keypad if you have not already done so. And you may withdraw your question at any time by repeating the 1-0 command. If you are using a speakerphone, please pick up the handset before pressing the numbers. Once again, for questions, you may press 1, then 0 at this time. Our first question from the line of Jackie Fortier with KPCC. Your line is open.
Thank you. Dr. Ferrer, I'd like to hear why you think LA County's case numbers are so much higher than other major urban centers.
Yeah, thanks so much. It's a great question. You know, those case counts, you know, even as a rate, are high, but they're really high as a reflection of the fact that we have a lot of people, 10 million people in our county, and we do a lot of testing. So if you look at the numbers of people that are getting tested in LA County, when compared to the other large counties, we test more people. And as long as we continue to test more people, we're going to have more cases of people who are positive. I do want to note that The corollary piece of information that I think we all need to pay attention to as well is what's the positivity rate? So when everyone goes and gets tested, do we see an increase in our positivity rate? And right now we don't. Right now our positivity rate is overall slightly lower than 8%, and if you look at it for the last 7 to 14 days, it's dropped to about 5.5%. That's really a number that shows us, what's happening in terms of transmission in a I think, a more important way than just looking at the case counts. But thank you, and we'll take the next question.
And our next question from the line of Brenda Gazzar with Southern California News Group. Please go ahead.
Hi, thank you. Dr. Ferrer, you mentioned that the death rate of people living in skilled nursing facilities, while still high, has dramatically come down over the last 2 weeks. I'm wondering if you have numbers that you can share with us that show that, and then why do you think that it has come down in the last 2 weeks? Thank you.
Yeah, thanks a lot. And I do have numbers, and we'll release them through our communications department. I also have a really nice graph that actually shows the decline, and it's been a steady decline. Again, all of the deaths that are happening in these facilities are tragic, and we'll try to get that number as close to 0 as we possibly can, understanding that the people in these facilities are very fragile. And we're doing our best. But as I said at the very beginning, one of the things about this virus is we've continued to learn new things. And as soon as we realized that we had a lot of asymptomatic spread, and particularly vulnerable in our institutional settings, where when we test people, we actually find far more people who are asymptomatic and positive than we find people who are positive and symptomatic. It was time to sort of change the tactics and really go not only to a testing strategy, but just as important to a different infection control strategy, which really demands that everybody in the facility be wearing PPE, appropriate PPE, whether that's a surgical mask or that's an N95, depends on the work you're doing. That was a big change at the facilities, but it also introduced an extra layer of protection. And it has taken a while for us to see the impact of these changes. First of all, it took a while to get the changes implemented, and now it's taken some time to actually see that it's actually had an impact on death rates. As we've noted, death rates often lag behind some of our other indicators. I'm hoping that we continue to see a steady decline in the rate of death in our skilled nursing facilities, particularly for residents, but I also want to note it's important for us to have protections for the employees who also have really borne the brunt of healthcare workers who have been, in fact, faced with both serious illness and even death from COVID-19. So we'll continue to work on that, and we'll make sure that the communications folks at the Department of Public Health issue those exact numbers. We'll take the next question.
We'll go to Claudia Pashuta with KNX News Radio. Please go ahead.
Hi, thank you. For Catherine, I'm wondering if you saw or heard anything in the Sheriff's Department's response to protests that concerns you, and if so, do you plan to do anything about that? And I'm wondering how the board might respond to protesters' demands for systemic change. And then on COVID, Dr. Galley said last week that the county was switching, I believe she said, to only front-of-the-nose swab because there are fewer false negatives, and I'm wondering if it's being recommended that everyone test that way, front-of-nose swab instead of the oral swab. Thank you.
So I didn't hear the first part of the question, but I think what you're asking me is
if you had any concerns about the Sheriff's Department's response to the protest.
So I guess what I would say is, and it's not just about sheriff, it's about law enforcement in general, and my concern is that people don't recognize the importance of having law enforcement out there and appreciate the fact that they are equally as outraged with what took place and the murder of George Floyd. So, but in terms of their response, I feel that they have done an incredible job, not only the sheriff, but LAPD, all of our local police agencies have done an incredible job. Could they do better? Always. We can always do better, not just in law enforcement, but in politics and in every industry. We can always do better. So I have no real issues with how law enforcement has rolled out on these issues. And if there are any issues, I know that the sheriff will investigate. As Chief Moore has indicated, he will be investigating as well. So with that, Dr. Ferrer, Dr. Galley.
Hi, thanks for the question on the swab. So the county's drive-through testing sites are all shifting, as I mentioned on Friday, to the nasal swab. We're doing this because we do believe that the specimen collection yields a better quality specimen, and because of that, there's fewer false negatives, so the sensitivity is higher and the likelihood of getting the correct test result is higher than it is with the oral swabs, and that's based on a review of the available data across a number of studies. I do think that all of the different providers out there, there's a variety of factors to take into consideration when thinking about the best swab and test and vendor to use. Have to take into account not just the specimen collection, which is oral versus nasal or nasal pharyngeal, also has to take into account the type of staff that's available to supervise or perform the swabbing, the turnaround times among the various labs, and the quality of the service that's provided by the various labs. It's really important to do a lot of due diligence with all of the various labs out there to make sure that the public or the patients that are being served are getting the highest quality test results that are possible. Next question.
We'll go to the line of Olga Gregorians with the Los Angeles Daily News. Please go ahead.
Oh, hi. Thank you for taking my question. Dr. Ferrer, how would you explain that some skilled nursing facilities have a high number of deaths, understaffed, had problems with infection control in the past, and still have been approved by Los Angeles County to become designated COVID-19 facilities? I also noticed that data for those facilities has been removed from Los Angeles County website. How do you explain that? And I wonder if there's a way to find that data. Thank you.
Yeah, thanks a lot. I'm not aware that data was taken off of the website, so I'll check. I think if there's any designated COVID-19 facilities, they would still be listed. So let us check into that. I mean, there could be one of two explanations. One is it's an error. The other is that we don't have any COVID-19 facilities any longer. But we'll have to just get back to you. I know we wouldn't have intentionally removed that designation from the website. And I do know that there have been questions that have been raised about, you know, how does a facility get that COVID-19 designation? What kind of criteria are they being asked to meet? And, you know, it really is a set of criteria that are unique to the situation in the pandemic and that really look at the capacity of the entire system plus that facility in terms of their ability to really manage, as you noted, appropriately care for patients who are positive for COVID-19. You know, our team works really hard, and I want to note that our team is not just the infectious disease clinicians, but it's also the team that actually has responsibility for inspecting skilled nursing facilities, you know, under a contract with the state. And that information is also reviewed by our partners at the state. So, you know, from my perspective, there was a lot of due diligence that was done, and you also noted very few sites did become COVID-19 positive skilled nursing facility sites. And it really was a reflection of what was needed at a moment in time during the outbreaks. And as we've worked with more and more skilled nursing facilities to increase their own capacity to manage cases, I think we have a different landscape that's going on right now in LA County. But thank you, and we'll take the next question.
From the line of Colleen Shelby with the Los Angeles Times. Please go ahead.
Hi, thanks for taking my question. I wanted to know if health officials have been in contact with protest organizers to get the word out directly to protesters to get tested and isolate from individuals most at risk of contracting the virus, and also wondering how the protests might affect contact tracing methods.
I'll let Dr. Ferrer talk to both of those. Good questions.
Yeah, thank you. And, you know, we've reached out in general. We have a lot of community partners to just, again, emphasize it's so important that people can exercise their First Amendment right. And we're really proud of the courageous people who have been peacefully taking a stand against racism and police brutality. That being said, we've also really tried to make sure that people have good information about how to take personal precautions that really can help other people, and also other people can be helping you stay as safe as possible during a protest. We are, of course, working very closely with all of our partners now around making sure that people understand what the best course is of action to take if you think you may have had an exposure because of some of the activities you've been engaged in. And protests could be one of them, particularly if you found yourself in a very crowded situation for more than 15 minutes where you were very close to other people who may not have been wearing a face covering at all. Our recommendation still is that you actually, what we call self-quarantine for 14 days. That's the full incubation period for this virus. You should, of course, talk with your provider, particularly if you have underlying health conditions. That might make you a very good candidate for getting tested. We do note that a negative test does not mean that you won't go on to develop COVID-19 over the course of the 14 days. And again, some people actually have called us and noted that they know that they were in contact with somebody who later told them, oh, I tested and I was positive. And in that case, yes, those people are now close contacts. They should, in fact, go ahead and get tested and self-quarantine. Contact tracing in any group setting, and I don't want to, I want to note that being a part of a protest is really no different than having an exposure at an indoor mall or even at a restaurant or at the beach. In all of these sites, there are going to be people who may become or may be positive for COVID-19. And when you're out and about, that's why we ask you to protect yourself and protect others by keeping your distance and using that cloth face covering, because you could have an exposure and it will not come through a contact tracing system. Nobody knows that you were there. Nobody has your name. We can't call you. I have well over 1,000 people that call thousands and thousands of people every day. When we know their names and we have information, we can get in touch with them. For public exposures, it's a risk that you need to be aware of, and then you need to take appropriate actions because you may have been in a riskier situation. And that's why we say, if you think you had an exposure, the safest thing to do at this point is to self-quarantine for those 14 days to see whether you develop signs or symptoms. After the 14 days, if you didn't develop signs or symptoms, your incubation period is over, and from that exposure, you're very unlikely to develop the virus. And we'll take the next question.
Go to Denise Dador with KBCPZ. The line is open.
Hi, good afternoon, Dr. Ferrer. You mentioned earlier about asymptomatic spread and how this is a problem. The World Health Organization reported today that asymptomatic spread did not seem to go on to a secondary infection. Do you have any new thoughts on that?
Yeah, thanks so much. I do want to say that the science there's new emerging science every day. We have to look at the WHO reports and put that together with reports that have come out of the Centers for Disease Control and other scientists and researchers so that we can then best advise folks on, what should be the best course of action. I do want to say that there is unequivocally asymptomatic spread. So I don't want anyone to get confused that people who are asymptomatic may not be capable of spreading. They are, in fact, capable of spreading, and we all need to keep that in mind. The question is, how much are they spreading? And as you noted, what's happening with secondary spread. But I want to make sure that people don't walk away saying, oh, if I don't have symptoms, nobody has to worry about having an exposure from me, because that's actually not what the evidence shows us to date. And we'll take the next question.
We go to the line of Dave Lopez with Channel 2 News LA. Please go ahead.
Great. Good afternoon, ladies. Doctor, a couple of real quick questions, if I may. Governor Cuomo said recently that anyone who is protesting should assume they are positive, that they've been exposed and that they have the virus and get tested. Do you agree with that? Second of all, there was a report that said that there's been a slight increase at some of the labs of positivity rates. For example, it went from less than 4% at this one particular lab to almost 9%. Is that true? And I know you want to open up more, Supervisor, but is there any fear that maybe you're moving too fast, and will you still go ahead and try to open up the county even more on Friday?
So I'll answer the first part, and obviously, Dave, we are always taking a look at what public health is releasing in terms of the positive test rate and all. And make no mistake, we are doing this in a very deliberate and cautious way, and actually have been one step behind the surrounding counties just for that reason. Because of the size, 10 million people, we recognize that there are a lot of other issues that come into play. But we also recognize that the longer we stay closed, knowing that we actually can do it in a responsible way with social distancing and encouraging people to wear face cloth coverings, that we need to get back to work and get the economy back working, and we can do both. It's not an either or. But we do look at the numbers, and with the protest, you know, I have to say, when the question is asked to me, why are protesters allowed to go out and defy public health orders, but businesses don't get that same break? And the reality is that, you know, this is our new norm right now. So I'm hoping the people out there that are protesting are practicing social distancing and wearing face cloths, because I don't want to have to revisit in 3 weeks businesses that have on the cusp of opening that know that if they do not open, they will not ever open again. So with that, I'll let Dr. Ferrer answer the second part of the question.
Thanks so much, Supervisor. I also, I do want to note on sort of this exposure issue, and I know that Governor Cuomo said today, you know, just assume that you're probably positive if you were part of a protest. You know, I want to just do a little reality check, which is that we've been saying for months that everyone is probably best off assuming that they could be positive and that other people could be positive. So it's really not necessarily related to the protest. It's related to the notion, and I think the supervisor said it best, of universal precautions. Because we don't know at any moment in time whether we're infected or whether somebody else is infected, the best thing you can do as you go about your business is assume that other people might be infected and that you might be infected. And that's why we, you know, really stress how important it is to do the two things that we all can do, because there's a lot of things out of our control right now. We can wear a cloth face covering and we can keep our distance. And those are the tools that we have. And, you know, my sense is this goes for people going back to work, this goes for people going to the mall, this goes for people going to the beach. And it's not just an assumption you should make if you were a person who participated in a protest. It's an assumption you should make as you go out and about, you know, getting back to some of your more normal activities, because the risk is still there. And even though it may not be a huge risk, it's enough of a risk that we all need to take these universal precautions. And then just to clarify in the lab results, you know, we do put in our table, you know, the percent by each lab, but I want to say it varies a lot, both in terms of how it contributes to the overall rate, which, as you note, Dave, has stayed below 8%. But it contributes depending on who's sending specimens to that lab. And sometimes, for example, there's a contract with a whole host of nursing homes that goes to one lab. And that could actually, because at nursing homes, you know, our testing positivity rate is hovering about 11 or 12%. That would increase the positivity rate for the specimens going to that one lab. The important number is the total number, the cumulative number, and that's really stayed at about 8%. And we have time for one more question.
Thank you. That is from the line of Jim Roop with Westwood One News. Please go ahead.
Go ahead.
Hi, Mr. Roop. We do have the line open for you. Just a moment.
Questions?
There you go. Thank you. Please go ahead.
But the journal Nature has published two separate studies, one done at UC Berkeley, the other one, I think, in the UK. But they had two separate methods, and they came to roughly the same conclusion, that given most of the cases of COVID-19 have gone undiagnosed, both studies suggest without the stringent measures, including the masks, the hand washing, the social distancing, the so-called lockdown measures, that there would be, in just the U.S. alone, an estimated 60 million more cases. So these measures have been successful in stopping the spread. So in light of that, and in what else you said about the fact that the virus is still out there, and aside from the hospital capacity, which as I remember, was the original thought behind all these measures, what's the confidence in reopening?
Well, I'm going to let Dr. Ferrer answer about the confidence from a public health standpoint. But again, I'll say what I said to Mr. Lopez, and that is that this board has taken the state guidelines and applied them across the board. And the state is doing it based on public health. And obviously, this is a very fluid situation as it relates to the virus. Dr. Ferrer said that, we're learning something new weekly in terms of this virus. But we are doing this in a way that with our sectors, with the Resiliency Task Force, incorporating public health guidelines into the reopening, recognizing that in offices we may be having a lot of telework and a whole different dynamic in each office building in terms of the space used. We are cognizant of the fact that it's going to be ever-changing, but we're doing it in a very, as I keep saying, deliberate and cautious way. So with that, I'll let Dr. Ferrer answer the second part about the public health.
Yeah, I appreciate the question, and I think Supervisor Barger said it best. This is a deliberate process to reopen. I do want to note that other countries have reopened, and we're not the only place to look at what reopening can do and mean. And some places have reopened with a lot of success in being able to continue to see that they're slowing the spread. So this is not an impossible task that we have set before us. This is entirely possible to be able to reopen, do it in a manner that continues to slow the spread. But I think the supervisor used the appropriate words here. It has to be deliberate, and we're all part of it. I think the recovery journey is absolutely essential. It's essential that we make progress on our reopening. And I think if we continue down a path that's deliberate, that's watching the metrics that you can all see posted on our website, we'll continue to make progress. Thank you, and now we'll move to remarks in Spanish.
Buenas tardes. Para actualizarlos, nos da tristeza informarles que 10 personas adicionales han fallecido por causas de COVID-19. Esto eleva el número total de fallecimientos a 2,655. Para las 2,463 personas que fallecieron donde se identificó la raza etnicidad, el 41% son latinos, el 28% son blancos, el 18% son asiáticos, el 12% son afroamericanos, menos de 1% son nativos de Hawái o de las islas del Pacífico, y 1% se identifica con otra raza etnicidad. El 93% de las personas que fallecieron por causas de COVID-19 tenían condiciones delicadas de salud. Este número se ha mantenido constante. Hoy estamos reportando 823 casos nuevos. Como recordatorio, nuestros recuentos de fallecimientos y casos suelen ser menores los lunes debido a retrasos de los informes durante el fin de semana. Esto eleva el número total de personas que dieron positivo para COVID-19 en el condado de Los Ángeles a 64,644. Estamos reportando